Hello and welcome to the COVID-19 Special Edition Rogers Television Program. My name is Carol Merton, and today I am delighted to welcome Jill Umbach, who is the Bruce Gray Poverty Task Force Network Coordinator for United Way of Bruce and Gray. Have I got that right, Jill?
That's correct. Thank you, Carol.
Thank you so much for joining us today. It's been a while since you and I have chatted, and I never would have thought we'd still be talking about COVID-19 at this point in time. But I'm delighted that you're on the program to fill us in a little bit on what's been happening, how things are going, and what are the plans as we move towards recovery. So I'll pass it over to you, Jill. Take it away.
Okay, thank you so much, Carol. Well, I think just in reflecting on this year, I think we're into, year 3 of an ongoing pandemic, and we certainly have been hit hard with this latest variant. And so we are not seeing a slowdown of any of our programming. And so what we're advocating right now is really to look at how do we further an equitable recovery? So instead of getting back to normal, how do we get to a better normal?
That's a good way to look at it. Now, that's a different way of looking at it.
Yeah. So overall at the Poverty Task Force, we spend a lot of time supporting partners on the ground that doing frontline work. So we have seen a 31% increase in the number of people using community meal programs as of the end of December in 2021. There was a 300% increase in meals served in 2021 compared to 2019. We saw a 27% increase in food bank usage. The latest enumeration by Gray County and Bruce County, respectively. In Bruce County, we saw 64 people with complex cases around homelessness. And in Gray County, we saw 142 people that had complex cases, and they have joined our what is called the by names list, which is managed jointly by Gray County and Bruce County Housing. And unfortunately, in 2021, we saw 33 fatal opioid overdoses. So we are seeing certainly an opioid poisoning happening in our community, and that's impacting on people. But from the Poverty Task Force perspective, what we like to bring to the table is some of the issues that were there before the pandemic, but we're seeing intensified right now. And that is really around health equity issues and other equitable issues that impact on people's health and their livelihoods. So that we are still seeing people with low income, Indigenous people, women, people with disabilities, and other employment barriers being hit the hardest during this pandemic.
So before we go further, you mentioned the phrase around the table or at the table. Mm-hmm. Can you tell us, the Poverty Task Force has a lot of community engagement with and different partners, and I'm wondering if you can give us an idea on all of the people who are working together around these issues.
So we have over 52 partners that had come to the table of the Poverty Task Force. And of those partners, we're really looking at both frontline service providers who may be community food programs, housing and homelessness response. We also have people with lived experience with their own voices, our community voices coming to the table. We have government officials that come to our table, both at the municipal level as well as the provincial and federal level. And then we have people that work within the government departments, right? So we have our politicians that are looking at policy, looking at system change. And then we have people within the government that provide our social services that are also coming. We've also benefited from partnerships with research organizations, such as the 4-County Labor Planning Board. We have been working and supporting their precarious living series. So looking at what is it that makes people vulnerable, particularly under a pandemic. We work with Queen's University as well as University of Ottawa right now looking at housing. And in particular, we have a rent-safe housing project in Owen Sound that is generating data by engaging and talking with landlords and with tenants. And then we have our, as I said, a lot of the frontline nonprofits that we work with are community-based organizations. Some of them are formalized, linked to national offices like the United Way, Salvation Army, but then we also work with a lot of the smaller groups. The Good Food Box groups are largely all volunteers. A lot of the food banks are run exclusively by volunteers, the smaller ones. So we do try to have a very broad representation at the Poverty Task Force.
So certainly within your title, it talks about network coordinator, and you've just described all of the networks that happen to coordinate these efforts. So there's a couple of, we're learning as we go through COVID. Number one, there's a huge stress on the frontline providers, the agencies. How have you and others managed, because you've described increased demands on the providers, and these demands are actually life issues, like living everyday issues, and unfortunately for some, dying issues. How have you and others managed?
Well, I think it's safe to say everybody's exhausted.
Yes.
I mean, there's an overall sense of we've had enough. I think there's definitely outside stressors that continue to weigh on the, particularly in the charitable sector, where it's been challenging to fundraise for core operations, so for some of the stabilizing items. So in 2020 and 2021 at the beginning, we were able to benefit from transfer dollars that were coming, or funds that were coming through from the governments. So there was the social services relief funds, there was other funds that were coming through food banks, systems and things like that. What we are seeing going into this year is that funding's not necessarily there. What we are seeing is some funding that's coming down to employment, getting employees back to work, supporting smaller businesses to keep their employees, and less of it channeling through emergency response.
So at this point, I'm going to ask you to put a plug in for how people can donate, because what you're describing are really critical supports to those who often have the least. How can people support you?
Yeah, I think that identifying a charity and recognizing right now that they need to keep the doors open, and really critically is, we've had a tremendous outpouring of support to feed people.
Yes.
But you don't understand sometimes there's a lot of admin work that goes into doing that. Weighing food, managing food, writing reports, keeping the administrative on, paying the bills of a building. If I give an example of OSHARE. So it's really been fantastic to donate food and to donate out of our cupboards and things like that. And I'm not saying stop that, but give some consideration with your donations that there is a lot of administrative work that happens behind that. We need to account for every dollar that's donated. And therefore, if you can be looking at charities, there's an upcoming Pie Day in March, which will be looking at the selling of pies, and the dollars will go to CMHA's programming as well as OSHARE. I think Safe and Sound might be involved with that. I'm not 100%, but on the United Way. But these initiatives come back and provide us with some of the staff that can go out there and do that. There's smaller projects that are happening that are looking for donations that need to keep the doors open. So the staffing, we know that a lot of the grants don't necessarily support staff positions. They just support the direct programming, and I understand that. But when everybody wants accountability, people want numbers, they want reports, and it does take some time to do that. also gives us, when people do a general donation towards, say, the pandemic fund at the United Way, it gives us the ability to be flexible on the street.
Yes.
And so there is a new mobile outreach program with 10 partners. It's a pilot right now, but that larger pandemic dollars, whether it goes through us or another agency, allows us to be more flexible,
Yeah.
rather than and meet the needs of that individual
Yeah.
when we see them, rather than having to say it will only provide for this or that.
And one of the things for sure, and you'll be able to give even more detail, but the needs have changed as we've moved through. And having the flexibility to adapt to that has been critical. I mean, we started out with the need to have toilet paper and food, and now there's other needs that are important. So having that flexibility is so certainly donations to charities of their choice, the COVID relief program through United Way, Canada Helps would be a way as well.
Helps. Going to Canada Helps would be excellent.
Yeah.
I think that the challenges as well are going to be, some of them will be systemic in terms of how we need to change and how we need to respond collectively. It won't be any one agency that's going to get us out. It's going to have to be working together on pilots, working together just to be able to staff and have enough staff to provide some of the outreach support that is needed. If you're looking at housing outreach workers and others, we need dollars to keep the staff in place to provide the services.
One of the, going a little further along that, the costing of, you say you account, and you have to account, and you do account for every dollar donated, but we're hearing generally the costs of items and supplies is going up. Mm-hmm. So how are you balancing, what you have and the fact that just costing for the same amount of things must be changing? I wonder if you can speak to that, Jill.
Yeah, we know that the cost of living is going up. We know that, any of the freezes we had on rent is stopped. So now the freeze on utilities has stopped. So that we will see an increase in our utilities. We will see, obviously the rent rates go back to regular rental rates, but they're still going up. There's still a competition around housing. Finding a place that's affordable, finding a place that isn't being sold out from under you. And there's a competitiveness. The market right now is very difficult for a lot of middle class families. So what we're seeing now is an increase of middle class families that might be visiting the food bank for some extra food. And we've certainly seen new faces. And that just indicates how broad the impact of the pandemic is in terms of the economic impact of the pandemic. We are increasingly seeing families with double incomes that are saying all of these costs, something's got to give. And so they need that extra little support from the food bank. So that's what has been reported by the partners, that the food banks are seeing more new faces from the community. We know that there's a housing shortage throughout Grey Bruce, and in particular some communities, it's exceptionally difficult to find housing, so that people who are gainfully employed can't find affordable rents or can't find a house. I was looking at a data point this morning that the average house, it's close to 500,000 in Owen Sound to buy in. It's just getting crazy for a family of a couple of kids to try and get a starter home. So those are things that are impacting not just people with low income, but now people in the middle class. And I think we're going to see a lot more gas prices going up and so many other things that will cut away at people's income.
And certainly, one of my questions for you, are there any surprises that you're seeing as we're moving through this? So that would be one that wasn't really anticipated, was the middle income impact in the early days. So we know that the income generally in Owen Sound and throughout municipalities, there are different incomes. So You mentioned about affordable housing, but I'm not a millionaire. So what a millionaire could afford, I wouldn't be able to afford. So I need to know what does that mean, that affordable housing from someone who wants to buy a house? How do you define affordable? Because someone who's coming from far away where houses are 700,000 to buy might think 500,000 is a bargain.
Exactly. And I think that's the thing. People have different understandings of what is affordable. People do use the two terms. Usually you'll hear affordable or you'll hear attainable.
Okay.
And so affordable is really looking at the definition being 30% of your income goes towards your housing costs.
Okay.
So if you are paying only around 30% towards your mortgage and everything else you do on your house, then your income is enough to be able to sustain that and to live comfortable, because the remaining 70% can go towards your other household costs, food, and all the other things. So you're meeting your basic needs. We know that in Grey Bruce, people that are living below the poverty cutoff levels, which are around 32,000 a year, they're spending more than 30%. So their housing is not affordable.
Okay.
But you can also consider somebody with a double income who may have to buy into properties, say in Saugeen Shores or other areas, and they the term house poor is a good example of where you've bought a place that you can't afford, right? If one person loses a job, has to go on EI, you are at risk. Right? And so you can have a beautiful house, but with these current market prices, you may have bought quite a fancy place, or maybe it wasn't so fancy, but it cost that much. I can't imagine buying in, and so it's your mortgage rates and everything else. Everything else is going up on the cost of housing, utilities, and everything else. So attainable is that when you can move up and down the grid. So an attainable housing, when we talk about that, it's really your ability to buy, either get into the market, so a starter home, or perhaps you're downsizing the market. So attainable doesn't necessarily always have to be about price. It can also be about the type of housing that's available.
Gotcha.
So a senior might want to sell the big house, shift down to something that they can manage and is accessible, or has supportive housing attached to it. So what's available for that? Or you might have the opposite. A starter family wants to be able to get their first house going. And they just can't buy into the market because the competition is high. So we know we have a lot of people, have moved up from the Toronto area into this area. They've sold their house for, that 1.2 million, and now they can easily afford and put down and compete and win houses. So we are seeing and hearing from families that say, my son and his wife have come back with the kids and they just can't afford to buy in, and they've got good jobs.
Yes. Yeah. I'm wondering, the numbers you've stated are alarming, actually. For me to hear that, it's alarming. Mm-hmm. We also know that some jobs are no longer available because either, businesses have not been able to survive. Do you anticipate this demand continuing through 2022 and beyond?
I think that there is a huge challenge right now in the workforce, both in terms of the available skilled workers to match with the jobs that exist here. I think there are issues with retention, keeping a job, staying on a job, and that's for the employers as much as the employee. There's certainly, in a recent consultation we did with the Ministry of Finance on the Ontario budget, there were many manufacturers around the table that said, we simply can't find the staff. So that's where we need to go back and look at Are they paying a living wage? Are there good benefits? Is there housing? Can people afford to live where they work and where the jobs are? Is there transportation to get to and from a workplace? And what benefits are being offered that would invite me to stay with that company? So all of these factors. Right now, the 4-County Labor Planning Market Board in the last year has done a whole series of studies. And today they're just launching their precarious living study, as well as a series of profiles. And that's where they really examine what the expectations of employers are, what's the current market gaps. So an example would be right now we have a shortage of early childcare ECEs. And there's a large demand. We don't have enough in the area. It's jeopardizing childcare staying open. And then secondly, it then ripples down to women's ability to get back in the workforce. If you don't have stable childcare, for many women, it means you can't go to work. And so it has a connector effect. Yeah,
absolutely. And we've heard in communities, we want the young people with their families to come to the communities, but that would be a strong concern if I had young children. I mean, I'd be thinking twice about moving to an area that didn't have that ability to care. So it really affects the in-migration of young people to communities. So what other things did of particular, you talked about the wages, and I've heard different conversations about precarious employment and a basic wage. Can you speak a little bit about that, Jill?
Sure.
Please?
So, excuse me, in 2019, our living wage was calculated at about $18.39. And so a living wage is per hour. Yeah, the living wage is, one can say living wage or a livable wage means that you take into consideration the cost of living, the cost of food, housing, rent, transportation, and what it would cost a double income family with a couple of kids. What would it cost for them? What do they need to work? They need a full-time job at a livable wage with benefits to get by. Yeah. And that's to get by. What we're estimating right now is around $22 an hour. It's an estimate. We haven't got the final out because there's a lot of moving factors. As you said, there's a lot of moving numbers right now, and the cost of living is rising. So we're estimating it at the United Way around $22. It's gone up. Last year, it went down a bit in a dip if you use the same calculator because people were receiving CERB.
Gotcha.
So as you know, CERB was a form of a guaranteed income during the pandemic.
Yeah.
It demonstrated to us that a lot of people were able to hold on and take care of family, pay their mortgages by receiving that CERB.
Yeah.
And the calculation for that CERB was actually significantly higher than what you would get on social assistance, Ontario Works or ODSP. So it also demonstrated that the federal government saw what people needed to live with, to get by with, if you will, almost a basic income or a guaranteed income was much higher than what people get on OW or ODSP.
So that's a huge, huge indicator that maybe that's too low. I mean,
exactly. Exactly. So that's, straight up, people that were on OW and ODSP were going, what? That's what you need to survive. Well, they've known how long they've had to survive on a very low income.
Yeah.
And so, yes, that $2,000 was a huge difference between somebody else that might individually only be getting $800 at the lowest with OW. So quite a range, quite a difference. So right now we are advocating for employers to take a look at their package. Are they paying a living wage?
And that's approximately the $22 an hour.
Yeah, right now. But even at $18 an hour, are they paying that? Even at the 2019, are they paying that when we have, the minimum wage has just been raised up to that 15? But is it enough? And we know it's not. And then you mentioned at the very top of the program, cost of living is rising. Are we running it alongside with the cost of living? Are employers making that calculation?
So from what you're describing, and you had said where the poverty cutoff line is there going to be a change in that line? Because it sounds like more and more people are struggling, with the discrepancy and how do you define where the cutoff is for poverty?
Right. Well, the government does make that calculation. We haven't seen a new one come out for this year. So there is what they call a low income measure. So it's always been around 32 to 35. That's a low income measure. I don't know what the official one will be this year. StatsCan will come out in October with the latest census data. Just had the population count come out last week, who's growing and who's downsized, if you will, or where's been the movement in Grey Bruce. But we won't see the other data that was collected with the long census until October 2022.
Oh, okay, so it'll be a bit of time.
There'll be a bit of time when the government will set that. And one of the key things around that is that measurement is used for a lot of eligibility also for other supports. So eligibility for your GIS, the Guaranteed Income Supplement for seniors, eligibility for housing stability supports, rent geared to income. So there's those cutoffs play an important role on whether you will get any supplements or support from the government.
What I'm hearing you say, Jill, in this conversation, which is so helpful to get your perspective, we need community support to support community because there's a lot of people in high needs out there, for sure. We have about a minute or so in the program left. It always flies when I'm chatting to you. What would you like to focus on as your closing comments to us today?
I think that going forward, I mentioned it at the top of the program, we need to look at equity. We need an equitable recovery if we're going to have a better normal. So if we are going to come out of this pandemic in a better position, we need to look at income solutions. Yeah. Income solutions is what is going to get us out of food insecurity, out of housing insecurity, and it's going to promote full participation of people who are most vulnerable in our society.
Excellent. And equitable means some need more help than others.
Exactly.
So that ultimately all are equal, but some need more, and that's what you mean.
It's not equality.
No.
It is understanding where people need more targeted support and to do so in a manner that is dignified, that is not judgmental and is not, deserving.
It allows for the human dignity.
Exactly.
Jill, thank you so much for being on the program. Always a pleasure to speak with you.
Thank you, Carol.
Thank you for joining us here, and please join us again to learn more about programs and services available to you and to your family. Take care. Stay safe.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Every year, dozens of Canadians are killed or seriously injured because they take risks around railway tracks. Talk to your loved ones about rail safety. Visit stoptracktragedies.ca.
For 25 years, you've been helping to make our roads safer by doing the right thing. You've been the designated driver